Some of the interesting things, certainly the ASCO plenary session, which focused on whether or not delivering local therapy to patients who present with de novo metastatic breast cancer improves clinical outcomes, and particularly does it improve overall survival? And I think this has been a question that we have dealt with clinically, and we see clinically, when patients come in and present with de novo metastatic disease. And although it's a small subset of the patients, about 6% of patients with metastatic breast cancer that will have an intact primary tumor, I think this is such an incredibly important question, and one that is at the forefront of the minds of a lot of our patients. So to see that analysis and to understand that local therapy, surgery and radiation therapy to the primary tumor did not appear to improve or really impact long-term clinical outcomes for those patients, I think was just a really helpful question to have answered. And so I found that presentation to be particularly compelling, and I thought it was of great value for us to have an answer to that. There are ongoing studies, looking at that same question, and I think we'll get additional data in the coming years. But I thought that was really, really helpful to be able to see and answer that question that's been out there for some time. I have a particular interest in immunotherapy treatment applications for breast cancer. So one of the other abstracts that I had been waiting for and watching was for the study that looked at first-line metastatic treatment of patients with triple-negative breast cancer treated with the combination chemotherapy pembrolizumab versus chemotherapy alone. And I think we saw again that there appears to be a benefit for the addition of immunotherapy, particularly for the group of patients that are PD-L1 positive. And they separated out into ones that are CPS greater than 10 or CPS greater than 1 or no PD-L1 positivity. And you really see that the greater the degree of PD-L1 positivity in the tumor, the greater the benefit that appears to be gleaned from immunotherapy treatment. So I think that study really confirms that there is indeed a role for modulation of the immune system in the treatment of triple-negative metastatic breast cancer. I know there will be many, many more studies to come in that realm as well. And I think we're going to see a lot more, hopefully, immunotherapy advances in the treatment of triple-negative breast cancer.